Welcome back to your lofty program, State of the Nation, where we hasten the motions for national development. And when it comes to national development, you're part of it. And this morning we're going to talk about health, our existence, because we need to be around, we need to be alive to talk in terms of development. And what am I talking about here? I'm talking about COVID, Omicron, and the travel ban on Nigeria. Did you hear that? COVID as a pandemic, Omicron as the latest evolution, and the travel ban on Nigeria. With me in the studio is my brother Cosmas Uzodinma. You're welcome to the program.
Thank you very much, Bola.
Thank you for honoring the invite.
Yeah.
He is a political scientist. He is a researcher. So basically, we are going to enjoy the insightful insights that he is going to give to us. My brother, before we look at this travel ban on Nigeria, let's play around a little bit about COVID in itself, because the COVID has graduated 4 times. Mm-hmm. We had the first wave, we had the second wave, we had the third wave,
Delta variant,
and now Omicron. It saddens me because I'm not a morbid person, and I'm sure you're not a morbid person either. But it seems this COVID pandemic is becoming a crisis. Honestly, it's gone beyond pandemic. It's a crisis that is affecting all facets of our life.
Yeah.
But the thing is, we are now in a situation where a travel ban has been imposed on us. I will want us to take this from 2 angles, because I do not delude myself. Mm-hmm. There is an aspect that paints us in good light that this should not be happening to us. Mm-hmm. And I believe, because I know, there is another aspects which are self-inflicted by the way we behave and by the things we do that brought about this travel ban. But before we go into that, I want us to eulogize ourselves as Africans. It was doctors from Southern Africa, a few countries, some in Zimbabwe, some South African, that came up with this Omicron, and they told the world, this is it.
Yes.
To start with, I want you to talk in terms of how good we are for telling the world about Omicron.
Yeah. I think it's remarkable. And it's another example that Africa has shown the world, even the advanced world. Because if you look at first and foremost, the emergence of COVID itself.
That's right.
In Wuhan, China. Till today, there's still a debate
about who did what,
who did what. And even from some Chinese themselves blowing the whistle, saying, look, this thing has been on before it really came out.
The people are nowhere to be found these days.
And those people have disappeared. Mm-hmm. But look at South Africa, showed example.
Good.
Immediately they saw it. Somebody, a doctor, blew the whistle, told the world that, look, there is something we are noticing. Another variant has come. And immediately, and that is, what we are now seeing is penalizing information sharing, which is something that is should be commended. But rather, we are going the other way to penalize Africa for sharing information quick. And that is a disincentive to quick information for subsequent ones.
Information.
That's it.
Thank you. On that note, you see, because I quite agree to what you've just given us now, that they are trying to, I don't know what I can call it, either to give a dog a bad name so you can hang it. But there is no bad name syndrome here. We have behaved better than China did, like you said.
Yes.
And at the same time, we've now boiled down to this situation we have on hand, this travel ban. And I said it's going to have 2 facets.
Yes.
One pro, one against.
Yes.
Let me talk about us Nigerians.
Yes.
The travel ban is now from 3 countries. And then we are hearing news is out there that probably some of them will be rescinded before the end of the day or this or that. We're talking about Canada, UK, and
Saudi Arabia.
Saudi Arabia, maybe Argentina on the side. But
Australia.
In most cases, we don't go that far.
Yeah, we don't go that far.
We don't go that far. But the thing is, let me talk about us first.
Yes.
As at the last information that came out of the UK, 21 Nigerians got into the UK, and 19 of them were found wanting. Some have never been vaccinated. They have fake vaccination cards. Typical Nigerian. Fake vaccination cards. Some were vaccinated. Maybe they had one. They never had the second. You see, it's like we gave ourselves to them.
Away, yes.
Can you imagine? Out of 21 people, 19 were found wanted. I want you to talk about us first before we start talking about others.
Yeah. At the last count, only 3.78 million Nigerians
of course, yes,
have been vaccinated.
Yes, less than 4.
And that is for a population that is 206. So what you're having is less than 4%, like you said. And, never mind that. Note that these countries have embassies in this country.
Sure.
And in the embassies, they have their secret service people there.
Oh, naturally, yes.
And they're feeding their country on
what is happening,
what is going on in the country. And look at it. I traveled to about 3 states. Edo, from Edo State, I went to Anambra. From Anambra, I went to Imo. From Imo, I went across to Abia over the last weekend. But I know that everybody has forgotten about masks. Nobody's wearing masks.
Those basic rules we don't have.
Basic non-pharmaceutical rules.
Okay, that's a nice word.
For COVID prevention. It has gone with the wind. And when people see this, they will say, look, it gives call for concern that, look, this is the report we are receiving from our embassies, from our people in Nigeria. So we have to be very careful on how they are coming.
They treat Nigeria.
I've been vaccinated 2 times. I've gotten my 2 jabs. And they're talking about a booster jab.
Shot.
I will also do that.
Good.
But again, I see the whole problem. I was going into a government office recently. They said I must bring my vaccination card. I said, okay, I didn't know that you are not bringing your vaccine. People have to bring their vaccination card. They said I must bring it. But if I have my, what do we call it? If I have it,
PCR result?
My result on my phone, I could show it. Suddenly I opened it, and what I showed the man was the emails I've been receiving. The texts I've been receiving from NCDC and that I've been vaccinated. He let me go. But I was told that, look, that is not it. That next time I must have my PCR,
test to
show for it. And one day I sat by, when I came back another day to that same office, I sat by. I noticed some people coming up with the vaccination card, giving it to somebody to enter. When the person entered,
they were just recycling the card.
Recycling the card. Because the security man at the gate asking for this card was literally an illiterate.
Can you imagine that? Let me buttress that element of our local self.
Yes.
News is rife as we speak. Like you were giving us the figures that those that are vaccinated in Nigeria is below less than 4 million people.
Yes.
What bothers me, and like you said, all the embassies and high commissions are conversant of this information, that we were given vaccines, and as we speak, 1 million vaccines were not administered. And those vaccines have expired. With all the funds that we have, Cacovax plus the ones that were donated locally by well-meaning Nigerians and the rest of it, how on earth weren't we able to administer 1 million doses? If we can tell ourselves the truth about that, what about people that are looking at us? Give me your insights on that.
Well, you know what normally happens in the country is, I have been in the civil service. What's happening in the civil service and the public services, you see a very few people like Atada has just left here now.
Yes.
Who are working themselves out to deliver on the policies of government. But you see a majority that are sitting down. They don't want to do anything. They want to Humpty Dumpty policies out. And before you know it, things are expiring. Well, you know what you did at that time? Push on information. You know, put machinery on the ground so that on the go, you hit the ground running to deliver on all these things.
That's right.
But they wouldn't do it. Because at every point in time, what people are looking for, even when people are earning their salaries, they are looking for what are we going to get from doing this. And if you don't monitor it enough,
you won't get the desired effect.
You even see that they will even start asking for money from the bank. So, but what I'm saying is that, please, these things, you know, is something we are doing for ourselves. And so, and it's now, the blowback is on the image of the country.
Of course, yes.
You know, when people see you outside, when people go out and you shout racism, racism, racism.
What have you done?
Racism is a mental picture of a physical condition of a people.
I like that.
It's a mental picture. So without that physical condition, that mental picture will not exist.
Will not evolve. Will not evolve.
If somebody comes into Nigeria and sees that people are defecating on the road, it becomes that country where people defecate on the road.
So cholera should be the norm.
He will tell it should be the norm. And when he goes outside, he meets you, say, you are from Nigeria. He says, oh, that country where people defecate on the road. It becomes the image of the country. So so racism does not exist in the air. It has an oxygen on which it feeds.
It thrives, yes.
And that oxygen that feeds it is the character, the national character of a people.
We as a people.
We as a people. If we change it, like somebody went to Gambia recently for the Adama Barrow elections. She came back and asked a friend. I said, how is that place? She said, look, those guys were calm. And they went through the process very, very well. So automatically it affects. Anytime I say a Gambian, I will look for, those people who are calm.
Yeah, it becomes the norm. Hey, let me, thank you for your insights. Let me move a little bit forward. And happened what you said earlier, that you traveled, you traversed about 4 or 5 states in the south, and then nobody was adhering to the basic non-pharmaceutical rules.
Yes.
It brings to the fore this information that is now on ground about this Omicron and what it has for us. Lately, about a couple of weeks back, we had maybe about 500 plus cases.
Yes, 585.
585. Yes. And in less than a week, it became 2,496. 96.
Yes.
Which is a 330% increase.
Yes.
For God's sake, you're a Nigerian, I'm a Nigerian. We are all in this together.
Yes.
The only medium we have is this medium. What should we be telling our people? For God's sake, COVID is real. It's high time we know that it is real. But what are you going to tell our people, please?
That Nigeria is at the stage of rebuilding, is building back its economy. And if we are not careful, if we do not follow the rules, other countries of the world are going to impose even more restrictions on us. You know, Britain is careful, because not many strategic countries of the world follow them, like United States didn't follow them.
No.
But look at the strain it has put on us. Many of us might not be celebrating Christmas with our loved ones in UK and Canada.
Of course, because of this.
A lot of them had booked their flights.
A lot of them. There are many of us there.
And we're again playing in the hand. I have a friend of mine, my opposite neighbor. He was planning to just leave for the United Kingdom on the 17th. And when he saw these stringent rules that, look, when you come,
you pay 3.
You have to stay in the hotel. You have to quarantine yourself for 10 days. He calculated the money, $3,000, £3,000 sterling. He said, I no go fit to.
I'd rather keep the money.
He kept the money and he's sitting down in his house. And his business and interests in the UK are just there rotting. So what we say is that, it has economic impact, it has image impact, it has, and economic impact it ramifies into various areas. No job, no investment, and
it's all encompassing, really.
So because we live in a world where there is a network. The economy is a network.
It's a global village.
It's a global village. And what happens here? A little cough here will have reverberations across the board. And if it's a negative one, it will blow back on our economy.
Of course, yes. Of course, yes. And again, you see, like we were saying earlier, in terms of our management of these vaccines, some school of thought are beginning to think and say, hypothetically, that if we give these people 4 or 5 million doses and they could not administer 1 million of those doses, the same you and I, if they don't give us, we will go ahead and complain, won't we?
We will.
We will complain. You see, kind of factor this into your next comment, that if we keep doing things, what are called self-inflicted,
exactly,
and then we get results, why are we complaining? We falsify vaccine cards, we have vaccines, we don't administer, and when they do things to us, we start screaming. Please factor in that element of 1 million doses have not been used.
You can imagine when I read in the newspapers that the Federal Ministry of Health, the NCDC, has a plan to vaccinate 55 million people in the next 1 month.
You have a big laugh.
We all laughed.
You have a big
55 million.
And you can manage 4.
You didn't manage 4. You have nearly 30%, expired. But we can do it. We are a country, where there is the will, there is the way.
That's
if you
right.
see, what we did concerning Ebola, we need to activate the process of Ebola. I'm proud to be involved in the various campaigns that helped us stop polio.
Okay.
And Nigeria has a very good network of disease, fighting. I can tell you that like the polio system, those networks have been there.
Okay.
All we need to do is to fund them. All we need to do is to motivate them, incentivize them, so that, and these things can go. Let them find a way to, let them do the warp speed of finding a ways to move these things to the local governments. I think hitherto what has been happening is that the vaccinations, system has been concentrated in the big cities areas, like Abuja, Lagos, Kano, Port Harcourt. But a lot of the local governments are there, and these people come down, and immediately people arrive. Even what's so funny is, even those people that arrive, there are many cases where they were asked to go and quarantine.
They did not.
And the expectation was that an official of the NCDC was going to visit them. But I can tell you, almost all that are connected to me that came back, I will ask them, did any official visit you? They will say no.
Even by ordinary making a phone call.
Did they make a phone call? No. Why? Somebody arrives at the airport, you test him, he pays 35,000 naira, 45,000 naira. You tell him to quarantine, give us the address of where you're going to quarantine. We're going to check you up or call you. You never called. How much is a call?
Zero cost.
Zero cost.
Because most of all these networks will give it to them for free.
And nobody does that. So what do you think? How do you think that's going to play back on us? That's the issue.
See, the thing is, it's always good we discuss things like this because that is the essence of the media.
Yes.
The powers that be are listening. Our fellow Nigerians are listening. Everybody is concerned in this case. Everybody is concerned.
Let them activate the polio, the machinery that kicked out polio in Nigeria. It's there.
Yeah, but the thing is, polio was an all-encompassing. A lot of clubs like Rotary was into it, and the rest of them were into it.
Let them bring Rotary. Let them bring Lions Club. Let them bring everybody. Let's roll and get this done. Yes, let them. If they are there, they already know they are battle ready.
That's
the same people. I mean, it was a few years ago. It was in this regime that Nigeria was declared polio free. It's not up to 6 years. So the people like that are not dead.
And they really worked over the years. It didn't happen overnight.
It didn't happen overnight, yes. That was why Ebola, that was why we were able to fight Ebola to a
standstill.
Yes.
You see, because I wanted to run an inference to that Ebola and when we had COVID-19, because that's a plus for Nigeria.
Yes.
I need to say a plus for us too. When COVID came into Nigeria, it was brought in by an Italian.
Yes.
We didn't, because of that, say anybody coming from Italy is not, any Italian is not allowed. We were magnanimous enough to do that.
Mm-hmm.
When Ebola came in through one man named Sawyer from Liberia.
Mm-hmm.
We didn't say Liberians were going to castrate you, we're going to stigmatize you or this. Our sister was good on the job. Dr. Adarevo of blessed memory was good on the job, and then we did that. In actual fact, what I'm saying is, there are instances where we've been good. Mm-hmm. You mentioned polio. Yes. I'm talking about the first wave of COVID.
We're also good there.
We're also good there.
We're good there.
What is wrong with us as we speak? I guess it's high time I talk to the powers that be out there. The NCDC, the Ministry of Health, you have a job to do. We Nigerians, we are ready to work with you, and then we believe that things can be done appropriately. We are waiting for you to do things appropriately. Let us quickly take a commercial break, then I'll be back to get my brother's final word. Welcome back. We still have our brother in the studio, Cosmas Uzodimma, and he's been able to share his insightful insights with us based on the fact of Omicron and the travel ban on Nigeria. We've been able to weigh all the sides. In some cases, when we get reactions from countries, it is because we have self-inflicted situations that paints us in bad light. And when they react to that, we shout to high heavens. But at the same time, I would like to get his last word to you, our viewers. My brother, your last word based on this factor we've discussed this morning.
Thank you very much.
You're welcome.
There is a piece of information that gladdens my heart.
Let's hear it.
That was the Queen knighted a Nigerian, Dr. Chuka Nwokolo. He was in the recent list of people that were knighted by the Queen of England.
That's
for his role in fighting COVID-19 in the UK.
Can you beat that?
So I'm telling you that Nigerians will have the best corps of medical doctors in the world. Even in the US, there was a case of another Nigerian, I think a Yoruba man or something like that. And he worked so hard, he contracted the virus, and by the time he survived it, when we were bringing him out, the entire hospital was celebrating him. And I know that the FCT minister, again, I'm so proud of him because of the response mechanism he put in place in the FCT. So my advice is that, please, we should not flag down. That we should sustain the tempo. Let's not take COVID for granted, because there is a risk that Nigeria is getting onto a fourth wave. But by the special grace of God, we're not getting to that fourth wave. I know that the FCT administration is very equipped, has a new team of energetic men like Atada just left here now, and that we are well able. So Nigerians, let's band together and kick COVID out of this country, especially Omicron. We've done it before.
We'll do it again with Ebola. And the first wave.
We did it with the first waves, with second waves, and with Omicron, we will also defeat Omicron.
Thank you.
And please go get your vaccination. Thank you.
Thank you very much, my brother Uzodimma. And to you, our viewers, don't go away. The program continues.